This conference will now be recorded.
All right, folks. So good afternoon, everybody here on campus, as well as those online. So we're going to finish up this chapter as far as the cardiovascular system and look at some disease and pathologies. Now, for those of you that are on campus, I've already talked about the research paper and what we're going to be doing with that. Those of you online, after we're done with these slides, I'm going to talk to you about the research paper that we're going to be doing. And so this is important that as we see each body system that we're looking at and reviewing, we're going to be discussing, and as we have been, the different diseases and pathologies that are associated with that body system, that organ system. So here we are in the cardiovascular system, and you see we have two different disorders here regarding, and they'll work in conjunction with each other as far as arteriosclerosis and atherosclerosis. And you may have thought of them as both the same thing, and so they work as far as in conjunction with affecting blood flow through the arterial system and through the arterial system, through the cardiovascular system. And you'll see here that the term arteriosclerosis is a hardening of the arteries, which is not a good thing, and which this affects as far as the ability for the arteries to do what they can do as far as taking the tremendous pressure that's passing through them and adapting. And so we'll see here that this creates and contributes to the problem of atherosclerosis, where we're talking about plaques that occur and can take place within the arterial system. And you'll see here that cholesterol, other fats, other lipids build up in the arterial walls. Clots may stick to those plaques, and this can form a clot is a thrombus. See this term here? Thrombus? Highlight that, please, here. Thrombus is a clot. Thrombus is a clot, and a clot that is flowing throughout the vascular system would be an embolus. Okay? So floating into the bloodstream, when it's moving in the bloodstream, that is an embolus. It can block arteries, and if it blocks arteries going to major organs or within major organs, say the heart, say the brain, right, the lungs, this can lead to major damage, and this can also lead to, and remember, recall that I showed you last class, I put up on the board as far as I showed you what's going on with blood supply that would be going on before the clot, right? So it gets blocked, and then any blood supply that would be going to other parts of a tissue of an organ that are not receiving that blood flow would end up dying as a result of lack of oxygen and also lack of nutrition. Not a good thing. Here you're seeing next as far as what can occur in order to repair blocked vessels. So here we're looking at the heart, and you see we're looking at the right coronary artery, and we're looking at another anterior interventricular artery. Okay, and so you can see the blocked areas here. You can see them right here, and so they've done a bypass, right? A vein from the leg used to bypass, or you can see here as far as these meshes, these slits that can go into a blocked artery and push open and keep open the area that's having any type of issue where it's having minimal blood flow flowing through it. The next slide here, you'll see the term aneurysm, right? So part of an artery weakens and balloons. Have you ever had a balloon itself, right? Blow up a balloon or a ball, like a sports ball, like a basketball, something that receives air, and it has a defect in it, and it has like a bubble. Have you ever noticed that, a bubble, right? Or in a balloon itself, you're blowing and there's a little bit of like a bubble on it. Well, that you can think of as like an aneurysm that would take place, this defect that would take place, this weakening of a vessel, an artery in particular. And what will happen is that this can happen within the brain or within the abdominal region. And let me show you folks on campus here. So if I were to remove the organs of the abdominal pelvic region, all right, folks, so take a look over here, right? So folks, folks, look over here. So here, this vessel that I'm touching, this red vessel right here, this red one, okay? This is a very large vessel. This is called the abdominal aorta. It's a big, large vessel that goes down until it splits, it bifurcates here in the pelvic region. So it's this, so from here to here, right? This large vessel can end up having a defect present. This defect, let me show you here. So say this is the normal diameter, right? So let me show this online here. So say if here's a healthy normal diameter for abdominal aorta. Well, what can happen is looking at it from the front view, this is the aneurysm, this expansion, okay? Now, remember I said to you that when we were talking about arteries, I said that these large arteries have the highest blood pressure passing through them, highest pressure. Well, if they have issues as far as the ability they expand but do not retract, do not go back to their original size as far as the lumen is concerned, the inner portion of that vessel, it expands, it starts stretching the tissues. Can this rupture? What do you think? Can this rupture? Absolutely. This can rupture, and that can lead to devastating circumstances. This could lead to death of the patient. We would call this an abdominal aortic aneurysm, and it can rupture. And that would mean that there would be a lot of blood under high pressure passing where? Into the abdominal pelvic cavity. This is devastating, right? Many patients die as a result of this. Not all. So what happens is that we try to catch this beforehand and perform reparative surgery in order to prevent that from rupturing and creating a problem. In my years of chiropractic and having x-rays done on patients, in particular in the low back region, we've found these many times as incidental findings. Right? On x-ray, you can see shadows of plaquing in the vessel. And what will happen is that it'll kind of look like on a lateral view, on a side view for the patient, you'll see plaquing that can occur. So you'll see and what will happen is that you'll see kind of like a plaquing on the lateral view and the side view of the x-ray. And you can see the plaque, not as much as I'm just showing you an outline, but you can see plaquing in areas here that'll give you an idea that, hey, that aorta is an aneurysm. It's stretching way farther than is safe where it should be. And how about as a chiropractor, without having the x-ray, and this patient is an older patient usually, right? It's taken years for this to occur, and I twist the patient for their low back adjustment, could I create a problem or push down on their spine? Yeah, absolutely, that could be an issue. God forbid, right? You wouldn't want to rupture an aneurysm trying to do treatment to help them with low back pain, right? That'd be terrible. So, aneurysm. If it bursts, blood loss can be serious or fatal, like it says in the PowerPoint here. Heart attack, also called a myocardial infarction, an MI. Write this down. And so we can have issues as far as blockage of arteries present within the heart. And that's where we just showed you the stent, and we just showed you the bypass, what can take place. These are preemptive that can occur, or after, right, post a heart attack, we're trying to then open up those vessels to make sure, if the patient hasn't come in and had any type of work done up already as far as diagnostic testing, this can be then after a heart attack to look and see what's going on. Heart failure. So, sad thing with this, folks, is that this is pretty much what it is. You've all heard of, you might have congestive heart failure. Have you ever heard of CHF, congestive heart failure? Right? It's a terrible thing. And what happens is that unless the patient gets a heart transplant, the patient will just continue over time. Now, medications can help, surgeries can help, but are they going to fix what's going on? No. The heart is dying. That's really what's going on. It has this downward slope of having, function to lack of function over time, right? In my years of practice as a doc, I had a couple of patients that had heart transplants. And to see that patient go from pre-op to post-op and see how well they did post-op, remarkable. Think about this, folks. How crazy is it that we can reroute your blood flow, remove your old broken, right, not functioning heart, and replace it with a new heart from someone? That's remarkable, man. That's remarkable. I've also had the opportunity to work with patients who have had liver and kidney transplants. And again, to see them pre-op, before the surgery, and post-op after the surgery, it's miraculous. It really is. Now, some people do very well, and some people not so much. And that's just how it goes, right? But usually they try to give those transplants to folks that they believe are going to do well post-op. Arrhythmias. You'll see here on the board, arrhythmias. So we're looking at irregular heartbeats. That's what's going on. So the rhythm of the heart, there's something going on with it. There's something going on with the electrical activity that's taking place within the heart. And as such, there's this arrhythmia present. And we have pacemakers and different defibrillators that also can be added to jumpstart the heart if the heart goes into what's called a ventricular fibrillation, which is a very bad and not good thing. So there are different things that we can do treatment-wise, and also we can go in, and if a patient is having an arrhythmia, we can go in and surgically they can do things to also remove, like on purpose, damage areas of the atria and on the right side of the heart and left side also, those upper chambers of the heart, in order to stop bad electric activity, and then put a pacemaker in and help to keep a better rhythm. So there's different things that can be done. Quite amazing, quite remarkable. Here you're seeing, as far as this next image, this next slide, you're looking at seeing that we have the risk factors for cardiovascular disease. Okay, so genetics, number one, inherited predisposition, two. If your parents or your grandparents had issues with cardiovascular problems, yeah, more than likely you have a higher, chance of having cardiovascular problems. Issues with your the fats in your body, the elevated blood lipids, hypertension, high blood pressure, obesity, we get that, overweight, lack of exercise. So just on your own, just not doing what you need to do as far as keep physically active and fit. Over the age of 50, inflammation due to infections, chronic infections, and many times, folks, patients that are experiencing cardiovascular disease and problems have other problems in other body systems that they're also dealing with. So know that. You'll see here, as far as this high blood levels of the C-reactive protein, that will also contribute to issues with inflammation and function within the cardiovascular system. And then also homocysteine, which also, again, working at contributing to improper function present within the cardiovascular system and, the blood vessels as well as the heart. Can there be infections that can go to the heart? Absolutely. You'll see here strep infections that can affect the heart valves, endocarditis. You'll see here for Lyme disease. So this is also a bacterial type disease that can affect and as a result of tick bite. You'll see here myocarditis. So inflammation of the actual muscular portion of the heart, the myocardium. So infections, absolutely. You'll see here also, what is the title here? To focus on, so how you can save a life. Folks, so knowing CPR, knowing how to use an AED. The AEDs really, honestly, if you were to pull one from the area where they're stored, if there was a situation, it pretty much talks to you and it tells you exactly what to do and where to put things and when to not touch the patient so you don't get shocked as well as the patient, right? So these are life-saving devices and such, and life-saving procedures also, okay? Now you'll see here where it says chest compression, blood flowing. That's one of the key issues really with when you're doing any type of rescue intervention, is keeping blood flowing. We want it flowing, especially to where? To the brain. So this is very important until people that are trained in like rescue squad, whoever paramedics can get there at the scene and take over and do other things in order to help save this person's life. You'll see here that blood flow to the brain must be restored within 5 minutes or brain cells die, right? It's there's a very small window of opportunity to work on this patient and get things going and helping them. You know? Now, I've had experiences with patients who have been involved in having sudden cardiac arrest, myocardial infarction, issues where their heart has stopped and they've been out longer than just 5 minutes and still been able to recuperate and recover. But it's pretty scary stuff, and there's no guarantee as far as what goes on as far as when the person is resuscitated and what's going to happen as far as damage is concerned to their bodies. You'll see here, last slide for the day, as far as homeostasis and how does the cardiovascular system work at maintaining homeostasis. And so you'll see here that blood pressure is very much involved, the pressure that the blood is flowing through the system. We'll see here that delivery of nutrition, gases, oxygen, removal of CO2, removal of waste products, delivery of nutrients, delivery of hormones and such. So very important. So it's a highway that passes throughout all the body systems. You'll see here that blood flow adjustments to different body areas made by the vessel contraction or enlargement can aid in and also provide more or less blood to an area depending upon the situation, whether it's really cold outside or really hot, what's going on as far as that control of the blood flow and release of body heat. You'll see here that the blood distributes body heat. And so if you're exercising, if you're real hot, right, what's going to happen? You're going to be flushed. You're going to look red because we're going to have the blood vessels are going to be dilated and releasing heat. That's why when you touch yourself after you're working out or after you're being outside and you're all red, you can feel the heat as a result of that, releasing that heat, the body is. And blood clotting, allowing the body to sustain minor wounds and such, right? We get that. So really the reparative ability of the human body is remarkable. And we'll look at as far as the immune system and such in more detail and discuss regarding repair and also throughout this semester. Okay, very good. So I'm going to stop recording class online.
This conference will now be recorded.
All right, folks. So online class, I'm just only with you all right now. My on-campus class is doing their lab work and such. So what I want to share with you first is that what I went over regarding your paper, your research paper. Okay. So you'll look at the syllabus. I'm sorry, I should have looked at that before I showed you this, and I'll by next class I'll give you a date as far as when the research paper will be due. But you'll see here that this is the paper and presentation that you all are going to be involved in, and you are going to pick a disease and you're going to then look up and research all this information on this page here. Okay, so this is in, let's take a look here. This would be in Unit 4. So can you see this? Unit 4, final presentation, paper rubric. Okay, so that's where you're going to find that. And so let's go here. And so you'll go through this and you'll let me know. So you'll send me an email regarding what disease that you're going to be studying and you're going to be working on. Okay, so it's important that you share that with me, please, and let me know because I don't want to have repeats. And so we're going to first come, first serve basis as far as sending me an email, letting me know what disease you're going to be doing your paper on. And if it's open, I'll let you do it. And if not, I'll just say, hey, someone else chose that. What else? Pick another one. Okay, but I would like to know that as soon as possible. And you're going to have a few weeks to do this. Okay. Oh, by the way, also remember that this week there is no quiz. So there's no quiz being held. I said that last class, but there's no quiz that you have to take. And so I want you to be able to like catch up on things a bit. All right. And I also have lab work for you to do that I'm going to share with you in just a moment. You'll also see here that it's important that you discuss the life of a patient who's living with the illness, challenges. Is it easy? Is it difficult to live with this illness? YouTube has vlogs, video blogs of people discussing their illnesses, so that might be helpful. Or look it up online, but you can have a minimum of 2 sources, but I would recommend more than that. That would be helpful in order to look up this information and study for this particular paper. Okay, so here you have the rubric for it, and the PowerPoint. Oh, actually, no, this is. Yeah, I'm not going to require that you do a PowerPoint. So I'm going to change. I thought I changed the rubric. I'm going to change the rubric a little bit more here. So I'll let you all know as far as the changes that I'm making. So I'm not going to require a PowerPoint. So yeah, so I'm changing the numbers as far as for the rubric here. So I'll give you that next week. Okay. You'll see here 3 pages minimum, right? More than likely you're going to do 4 to 5. Okay. But I have to set a minimum. So 3 pages is the minimum, 12 font size, double spacing. Okay. All right. So let's minimize this. And then we're going to also see here as far as lab quiz number 2. Okay. So you should have all had completed lab quiz number 1. You need to remember, this is unique. This is regarding the anatomical structures, and I have an online lab quiz number 1. It's located, so let's just show you all in e-learning, just so that you can see, because there are some that did not take the lab quiz. Okay, I reopened it for all that did not do that. But if you don't do it by the time that I had set for you all, you will receive a 0 for that. Okay, so let's see here. Now this is documents and resources. Let me show you coursework. There we go. That's why I wasn't finding it. And so let's see here. So yeah. So let's do this. I'm going to change the view here, so you look at it from a student's view. And you'll see in Unit 1. Let's see, is it Unit 1? Here. Yeah, Unit 1. Yep, lab quiz number 1. So that's what you need to click on. And once you click on this, then it'll give you, it'll give you the instructions. You'll see here the instructions, and it wasn't open. I'm as a that it's don't pay attention to this. Other than that, it's not giving you the opportunity to take it because I'm not a student. That's why it says a 0, an F. And it's not allowing me to take it. That's because I'm not a student. But you'll see here as far as this is the instructions for you, okay? And so it's not real super difficult, but you need to study and you need to, put some time in, and you need to get it done or you'll receive a 0 if you don't turn that in. So again, lab quiz number 1, it's the anatomical structures. You'll see images. You'll have to identify what I ask you to identify as far as on those images. Okay, so lab quiz number 2 will be the same thing. Okay, so as we come here, yeah, so if you just put it in there, that's fine. Send me an email. I really want, do me a favor and send me an email with the disease. This way I have, when you do it on the chat, it's not documented for me. So send it to me via email, please. Okay, thank you. So you'll see here, as far as lab quiz number 2, these are the structures, right? These are all the anatomical structures that will be on lab quiz number 2. You'll notice that the reproductive system, male and female, are not on the lab quiz number 2 structure list because they'll be asked as far as on the final exam. I'll ask some questions regarding that. But lab quiz number 2, online quiz, lab quiz will be all of these structures you'll have to identify. Now, in order to help you do that, okay, so let's go back to the regular view. In order to help you do that, I have posted in documents and resources. Scrolling down here a little bit at a time. So here's heart and blood cells labeled, unlabeled, heart image unlabeled. There's also labeled images, right? So you'll see here heart anatomy, blood cells labeled, okay? And you'll see here as far as Other structures, pancreas, tonsils, digestive system, they're labeled and unlabeled. You will have to go through and actually print those out or digitally do what you need to do and make sure that you're labeling what needs to be, that's unlabeled, you need to label that, okay? And also in number 4, unit 4, we also have structures for you that you'll print out, okay? All right, folks, very good. So let's take it here. So, all right, so let's see here. Okay, very good. All right, excellent. So I'm going to stop recording here right now.